No, I felt pretty good. I felt good, but looking back in retrospect, didn't really understand how bad I felt.
Nearly 3% of Americans have a diseased heart valve, and that's according to the CDC. Each year, thousands of them undergo surgery to have it replaced with either a mechanical valve or animal tissue.
And in tonight's special report, we take a look at another surgical option that's rarely performed, but it's happening at a Chicago hospital.
Just like riding, scuba diving with my kids, fishing, just being involved with outdoor activities.
After years of adventure sports and working as a police officer, 56-year-old Joe Lakashik can survive just about anything. Right now, the recently retired Hillside chief is recovering from a rarely performed heart valve replacement surgery.
Our plans were to retire and move to Florida. And knowing that we were moving to Florida, I just decided to get my heart checked.
Knowing his family history, Joe's doctor sent him to get a stress test and an angiogram.
Every time I saw a doctor, a nurse, and even the techs that were doing the tests, they would look at the test, they'd look at me, and they'd be like, "You don't pass out?"
Those tests showed Joe had aortic stenosis, meaning the aortic valve in his heart was narrowing. It needed to be replaced because his heart was not pumping out enough blood to the rest of his body. If left untreated, it can lead to sudden cardiac death.
I'm moving down to Florida. I want to scuba dive. I want to fish. I want to ride a motorcycle.
That also means Joe didn't want to have his heart valve replaced with a mechanical one or with animal tissue. He says it would make it difficult to enjoy all of his favorite pastimes because he would have to be on blood thinners the rest of his life.
I researched the heck out of valves, replacement surgeries, and I found what was called the Ross procedure. Very, very few doctors across the country even perform the surgery.
One of them is right here at Northwestern's Bloom Cardiovascular Institute in Chicago. Meet Dr. Chris Malacery.
So we like this procedure because it's the patient's own parts, and we think that the living tissue has a better life expectancy, better durability, and may be resistant to infection.
Surgery video from Northwestern Medicine named after Sir Donald Ross from England. This procedure was developed in the 1960s. It's also known as the switch procedure.
We use the patient's own pulmonary valve, which is a living valve, and use that as a replacement. And we use a donor pulmonary valve to take the place of the pulmonary position.
Unlike a transplant operation, patients undergoing the Ross procedure don't have to wait for a donor to become available.
Donors are rare, but we can take the pulmonary valves from the donors and then freeze it right away. So the freezing process will make sure that all the cells from the previous donor are no longer there. There's no risk of rejection with pulmonary valves from these donors.
Once frozen, Dr. Malacery says that pulmonary valve can be saved for about 5 years.
I offer the procedure to patients who are less than 50 years old or patients who look like they're less than 50 years old, because younger patients have the most to benefit from the Ross procedure.
6 years over the age limit, Joe was his own advocate and worked to convince Dr. Malacery to perform this procedure on him anyway.
Well, after talking and after discussing it and after begging him and pleading with him, basically, we made a deal.
Joe promised me that he was going to get in better shape, lose some weight, and look like someone who's going to live well into his 80s or 90s.
About a month later, after losing some weight and changing his diet, Joe got his wish. Dr. Malacery performed the Ross procedure on him at the end of March. We caught up with him about a week after the surgery.
I honestly thought I'd be down for a month. I was down maybe 2 days in ICU. Looking back in retrospect, didn't really understand how bad I felt.
As for how he feels about Dr. Malacery,
there's words really can't describe him.
Emotional stuff. The Ross procedure takes 5 to 7 hours to perform. Northwestern Medicine does only about 25 of these surgeries every year.